So this is a young patient of left hip joint, and he has some problem with the ligaments of the hip, and he has continuous pain despite of platelet therapies and other therapies, conservative therapies. So today we will do cooled RFA of left hip joint. Patient is clean and draped. We have marked the course of the femoral artery here. It is important to mark the femoral artery because when we place needles for the RFA, we will avoid injury to the femoral vessels. This procedure is done under local anesthesia. We have given local anesthesia. This is the 10 centimeter cooled RFA needle with 4 mm active tip. So we will enter first for the 12 o'clock position. So this is the left hip joint. We will do 2 entries, one for femoral, another for obturator. Above this joint, first we will go at 12 o'clock position. So we will mark the 12 o'clock position. This is 12 o'clock position above the acetabulum. This is 12 o'clock position. Save. So this is for femoral now at 12 o'clock of the acetabulum.
Look, right pointed.
Now we are introducing second needle for the obturator now. So this is the final placement of the 2 needles. Upper one for femoral nerve, this is for obturator nerve, that is the image. This is how we place 2 needles for hip joint cooled RFA. After confirming the position, this is the electrode with 4 mm active tip. We will do it one by one. First we will do for femoral. We are introducing the electrode, and then we will do for obturator. So we have placed the electrode. Now we will do sensory and motor stimulation for femoral nerve and see whether we are hitting any muscular branch of femoral nerve or not. Stimulate.
So sensory stimulation start. Point 1.
दर्द आया?
Yes.
In your hip joint?
Yes.
Huh? Same kind of pain.
Yeah.
So we are ablating the nerve, and that's why you are feeling the same pain, okay?
Okay.
Anything going down to leg?
No.
It is only in the hip?
Yes.
Okay. So the pain is only in the hip, it is not going down to anterior thigh along the distribution of femoral nerve. Now we will do for the obturator now. We will introduce the electrode and do the stimulation. Confirm the position once again, it is okay. Save. Any pain? So we have done the sensory motor stimulation, we are giving local, and after that we will do RFA for the obturator nerve. So the pain is going to the hip joint only, it is not going to the inner side of thigh. So we are stimulating the genicular branch, not the obturator branch. So this is how we do 2 lesions. Thank you.